talking about the pathology of diverticulosis and diverticulitis. These two conditions occur in the large intestine. This diagram right here shows what a normal healthy intestine would look like. When there are one or more bulges or pockets, they are known as diverticula. These pink dots here would indicate what diverticula would look like on a large intestine. These pockets are formed by increased pressure in the colon and form where areas are weakened. The diverticula can form anywhere in the inner colon lining, but they are usually found in the lower left portion of the colon, known as the sigmoid colon. Diverticulosis is just the presence of one or many diverticula in your colon. This condition is typically doesn't have any effect on the individual and no symptoms occur, and treatment usually isn't needed. But having presence of diverticulosis can eventually lead to what is known as diverticulitis. Diverticulitis is inflammation and infection in one or more of the diverticula. These red dots right here would indicate what an inflamed diverticula would look like. This occurs when pieces of food or stool passes and become trapped inside the pockets. Bacteria then starts to grow and will eventually multiply, leading to an infection. As this disease progresses, abscesses could form and peritonitis could occur. Peritonitis is when the peritoneum, which is the tissue that lines the abdomen covering and supports most of the abdominal organs, become infected by the diverticulitis that has ruptured. And when the diverticulitis ruptures, the intestinal waste tends to spill out into the abdominal cavity, which will then lead to the peritonitis.
I'm going to talk about signs and symptoms of diverticular disorders. Diverticular disorders, there are two different kinds, diverticulitis and diverticulosis. Diverticulosis and diverticulitis, they do have some general signs and symptoms such as cramping, nausea, chill, fever. As you can see here, lack of appetite and constipation, gas and bloating and cramping, and sometimes anorexia. These signs and symptoms mostly actually is about diverticulitis, which has been talked about, but to cap it off, diverticulitis is when the little small bulges in our large intestine gets blocked with feces and it gets infected, so it's called diverticulitis. And they do sometimes resemble pancreatic problem or ulcer, peptic ulcer. So the doctor has to actually do palpation as an assessment to figure out if it's diverticulitis or any of the other disorders or problem. And sometimes the doctor may actually order some tests like CBC, liver enzymes, a cold blood test for stool, and even CT scan to see the actual bulging if it exists. Now let's talk about diverticulosis symptoms. Diverticulosis is the bulging of large intestine, and at this time it's not really affected. It usually it doesn't really get diagnosed because it doesn't really have sign and symptom as obvious as diverticulitis. And sometimes patients will have abdominal pain or cramping in the lower part of lower quadrant, left and right, but not much. How to diagnose that is sometimes it's diagnosed as secondary findings when there is a colonoscopy done or any testing for sigmoidoscopy, things like that. So that's it. And symptoms of diverticular disease are also dependent on severity of the disease and where it's located. Location is mostly the lower left quadrant and right lower quadrant. And by touching the lower abdomen actually feels tender, and the patient will have sometimes fever, nausea at the beginning, and it could actually even become a big problem, and it could have surgery.
Hello, I just want to talk about the etiology or causes of diverticulosis and diverticulitis. Overall, the exact cause of diverticulosis is unknown. However, they are generally caused by weakness of the bowel wall and increased intraluminal pressure. So this happens more likely when someone is constipated and straining. When the diverticulum is blocked, the blood supply is cut off, and bacterial infection is more likely to happen, which is when diverticulitis occurs. I have this little diagram. So there are a lot of risk factors, which include age. If you're over 40 years old, you're more likely to develop diverticulosis. If you're overweight or obese, you are likely to develop diverticulosis versus those who are at a healthy weight. If you smoke cigarettes, you're more likely to develop diverticulosis, more at risk for that versus those who do not smoke. Lack of exercising is as well a likely contributor to diverticulosis. And a diet such as like a poor diet, like low fiber diet, also contributes to diverticulosis. When someone eats a low fiber diet, they're likely to be less regular with their bowel movements, which then can cause extra pressure on the diverticulum and then result in diverticulitis if they do already have diverticulosis. And so that's an issue. In this diagram here, you'll see the man in his chair. He's eating pizza with pepperoni, a cheeseburger, and he has soda cans right by his chair. All of these things they have zero fiber. Animal products don't have any fiber. Soda obviously has zero fiber, so he's setting himself up for failure. So these are the risk factors of diverticulosis and diverticulitis. Thank you.
All right, so for my portion, we're going to talk about the nursing interventions that need to be taken into consideration for diverticulosis and eventually diverticulitis. First and foremost, in the stage of diverticulosis, you're going to check for mobility, and generally speaking, greater mobility equals lesser severity of symptoms. Next, you'll assess the temperature of the patient, and if they're febrile over 100 degrees Fahrenheit, that's a big indicator. And like always, we focus on assessment first and foremost with each step. So these are mostly assessment pieces to make the determination as to whether or not they're still experiencing symptoms of diverticulosis or if they've progressed. So you're also going to check for any abdominal pain. And anytime the patient's had abdominal pain for 3 days or greater, that's definitely a rise for concern and the potential of progression of the disease. You want to make sure that you're checking the patient's stool for any black or tarry stools and also the presence of blood, because that's a problem. As it progresses through either infection or inflammation, it becomes diverticulitis, and we're going to talk about 3 different major nursing interventions and nursing diagnoses. The first one being constipation. And with constipation, you want to assess the patient's bowel habits. And you're going to check for the time of the bowel movements. You're also going to check for the frequency, so not just what time they're on schedule, but how many times they're using the bathroom a day. You're going to check for the amount of stool. You're also going to check whether or not there's, again, blood or mucus present in the stool. The next assessment point for constipation is assessing their lifestyle habits. So at this point, you need to talk to the patient about whether or not they're exercising routinely, whether or not they're getting a sufficient amount of water or other fluids. and what they eat. So their diet is going to be a big portion of that also. The next thing you need to talk about is their typical personal treatments for it. So any over-the-counter medications that they might use, stool softeners or laxatives, need to be taken into consideration. Next is diarrhea, and the nursing diagnosis for diarrhea leads to the interventions of assessment for dehydration. And again, constantly assessing is your first step, and you're going to check their skin turgor. This takes place over the sternum. You're also going to check for excessive thirst and watch for drying of the oral mucosa. And this will come up again in a different nursing diagnosis, but you also want to watch for any cramping in their abdomen, and then make a determination as to whether or not they have longitudinal furrows in their tongue. Another thing you need to do is provide a readily available commode and make sure that they have access, quick access, to a toileting facility. Make sure that you encourage small meals for that patient. It's going to be things like bananas, potatoes, and rice, things that are easy to digest. Over time, if they start having lesser symptoms, you can get them back to a normal diet, a normal eating routine. But you're also going to want to make sure that patient avoids caffeine, any kind of natural diuretic. You don't want to aggravate those symptoms of diarrhea. The next diagnosis that we're going to talk about is the risk of deficient volume, fluid volume. And basically the first thing again is assessment. You're going to check for any hypovolemia. You will assess their thirst, determine if your patient's having frequent headaches, and also check for the inability to concentrate and any confusion. One of the other things you want to watch for, again, is that drying of the oral mucosa, and make sure that they don't have any of those longitudinal furrows in their tongue. Last piece there is weighing the patient daily. If they've got some fluid loss, their weight will change, and a big piece to that is making sure that you do it under the same conditions every time. So if you're weighing the patient in bed, make sure the linens are the same, make sure that they have all of the same conditions basically, so you don't dilute the data. Anyhow, those are the nursing interventions, and that wraps it up. Thank you.